perspective. This is way too small to read, but it gives you kind of a sense of the scale of the activity in medtech in Ireland. We have over 25,000 people, about 27,000 people employed in medtech. We're the second largest exporter of medical products in Europe. Some of the numbers are very compelling. You've got kind of 33% of the world's contact lenses are manufactured out of Ireland, 80% of the world's cardiovascular stents are manufactured in Ireland. So it's quite a significant business for Ireland. And then on the pharma side as well, we've got kind of 9 of the top 10 pharmaceutical companies here. The last decade has really been the decade of investment. We've had over $10 billion worth of investment in infrastructure in Ireland to make the next generation biological products. So working as a technologist, my role is really part of my role is really to kind of identify where the new opportunities are and how Ireland can compete in those areas. So, if you kind of this is nice, it's easier. Great. So, I suppose I analyse really where the change is happening in healthcare, and I suppose this slide kind of sums it up quite well, that there's a real move in healthcare towards a more personalised approach, where the information flow is integrated in two-way, and with the patient really being the centre of the healthcare, the focus of the treatment. Cost has been reduced a lot in healthcare by moving it towards the decentralisation, or moving it into the community and away from the hospital. And the treatment is becoming very collaborative, with a lot of shared information across multiple healthcare providers. So instead of just going to your cardiologist, you're going to be coming to see a suite of healthcare providers. Probably the most important one is outcomes are really going to drive the reimbursement or the payment for healthcare. So instead of just being procedure-based, it's going to be based on the outcome that's been derived from the treatment. And then I suppose the objective of it of healthcare is moving much more much more away from the diagnose and the treat, into the kind of prevention and wellness. So there's a lot of kind of macro factors driving this. I suppose primarily there's an increasing cost of care from an aging population and an increasing incidence of chronic disease. But then there's also the multiple other kind of macro factors, such as urbanisation, globalisation of the value chain, geographic shift in the marketplace, and then kind of a convergence of technologies. And that's really where I operate, is in that convergence of technology space. So looking at technologies such as big data, technologies such as Factory 4.0, how that's going to affect how we manufacture our products. I'd look at technologies such as additive manufacturing and smart devices. And they're the two that have really focused our talk today on. So additive manufacturing, it's what is it? I suppose most people will be familiar. It's a method of building up material layer by layer to make incredibly complex products. So the complexity is free with additive manufacturing. It really doesn't matter if you're making the most rudimentary part or the most complex part. And it's that complexity that's turning design and manufacturing on its head. So I suppose from a healthcare perspective, I'll just talk through a little example here and show how some of the innovation supports in Ireland are kind of contributing to this knowledge development in Ireland. So osteoarthritis is the most common joint disorder in the world. In the US last year, there's been about 700,000 total knee replacements, about 300,000 total hip replacements. And basically what happens there in that procedure is the surgeon will take a lot of measurements before the procedure, then go in, then cut the patient open and remeasure, then go to the shelf and take maybe one of 7 products from the shelf based on the size measurements, and then fit it to the patient. But I suppose 1 in 5 patients are really not satisfied with that off-the-shelf approach. They complain of poor fit, poor alignment. So if the implant is too big, you'll have excess material abrading the tissues around the joint. If the implant is too small, you'll have bone exposed, which can be quite painful. and if the implant is misaligned, you will get a poorly fit or an unnatural feel. So with additive manufacturing, I suppose it's now possible to create a 3D image of a joint of the patient's joint prior to surgery, and build a customized product which takes account of their anatomical nuances of a particular patient. Not only can you make a customized joint, we're seeing companies also making customized instrumentation as well, and disposable instrumentation and throwing that away as well. So really from the CT scan you can build up into a CAD drawing and make that personalized implant, where really the implant is fitting the patient as opposed to the patient fitting the implant. And the benefits of that are really, from a hospital's perspective, they reduce a lot of the inefficiencies around procedures and able to reduce a lot of the cost associated with measuring and remeasuring, and surgeons taking up their time doing a lot of clinics with poorly fitted implants. The patient obviously has less pain in theory and a faster recovery time, but it's really the industry that's driving this. They're able to move towards a just-in-time delivery model and really remove inefficiencies around shelf life and have very differentiated products. So on a kind of a hype cycle of where is it, I suppose, where does additive manufacturing sit with healthcare? This really depends on what type of products you're talking about and what type of materials are in those products. So from a non-invasive parts made from polymer materials, they're widely adopted in certain cases. So there's over 10 million cochlear implants, or hearing aids, should I say, in existence today. This is completely juxtaposed to the 3D bioprinting, where the technology is very poorly understood, and industry really haven't got a grasp on the key technical issues of how to implement this. I suppose in Ireland here we're seeing a lot of traction on 3D or invasive parts made from metal. There's a lot of industry here in that space, so with the likes of Stryker, Dupree, Boston Scientific with some of their cardiovascular products. But really, they have a long journey to get through in terms of the technical questions. So I think with additive manufacturing, the concept is very easy to understand. The benefits are quite easy to communicate, but the engineering is incredibly complex. So companies have to kind of answer how are we going to characterize the part once it's made. You know, kind of how do we validate processes. How do we do post-processing on this? How do we get the materials that are really quite expensive and reuse some of the powders that haven't been used already? How do we characterize those powders? So no one company is going to be able to answer all these questions by themselves, and we're seeing a lot of industry coming together and doing strategic partnerships to kind of answer these questions. And an example of this was a recent industry innovation partnership with the SEAM Institute in Waterford, where they got a multinational company who really want to be positioned as the global site for 3D metal printing within their organisation. And they joined up with an Irish indigenous company who was in the medical space, but also served a lot of other sectors such as automotive and aerospace, and they really wanted to be seen as the place for the contract manufacturer for 3D additive parts. So there was an innovation partnership where they got together and they tried to answer a lot of the questions and share the outcomes of their learnings. So SEAM were involved a lot on the process technology, and the multinational company were involved a lot on really giving that end user perspective, but also kind of how do you validate those parts. And the indigenous company did a lot of work on the material characterization. I suppose from an innovation partnership program point of view, 65% of this activity was funded by the state, and the remaining was split between the companies involved, both in terms of cash and benefit in kind. So the next technology I want to talk about is smart devices. There was a great talk earlier on from Philip from Intel over on the main stage, where he really kind of was talking about this Internet of Things and incorporating sensors into it, into devices. So really like to kind of touch on that from a healthcare perspective and say what are the trends that we're seeing here. So I've taken the example of a diabetes patient. Currently a diabetes patient will have a lot of autonomous control over their condition. they'll have a glucose monitor, take a measurement, and then adjust their treatment based either through self-injection or through a pump infusion system. And this autonomous control makes it very difficult for the doctor to get a good understanding of what they're doing. So the diabetes patient will typically only see their doctor maybe at most 4 times a year for about 10 minutes each time. So when they go, it's very difficult to really communicate how well they're managing that disease, and really kind of communicate the compliance and the impact that their lifestyle is having. So we're seeing a lot of life science companies moving into kind of smarter devices. So the devices of the future are they're really chasing devices where they can incorporate the blood glucose measurement into their device. They can incorporate sensors which will track activity. They will link this to other data, such as how social the patient is being, for example, or what the diet of the patient is through tracking apps, and then they link it with other comorbidities. And I suppose this gives the doctor a much more holistic view of the patients once they do see them, and they're able to drive their treatment and manage their treatment a lot better. So obviously there's benefits here from the patient. They're really able to gain ownership of their disease. The healthcare provider is possibly able to kind of remove inefficiencies and take move the location of care outside of the hospital and kind of onto let's say a web-based platform. But the real benefit here is for the industry. With this model, the products are obviously very differentiated, but it also allows healthcare companies to move into generating new revenue streams so they'll be able to offer patients coaching services. They'll be able to sell some of the compliance data that they gather from the devices, and sell this on to third parties, such as insurers, where the insurance company can really incentivize compliance through lower premiums and so forth. So again, looking at the hype, there's a lot of hype around a lot of these kind of IoT devices, and it's really kind of getting a perspective of what's going on. And in this, it really depends on what type of device you're talking about, and also what kind of data analytics are being run on it. So in terms of wellness devices or monitoring devices, that's typically done with descriptive analytics. So it's able to describe the number of steps that have been taken, or be able to describe, let's say in the case of an implantable cardiac monitor, be able to describe the EEG data. When you move beyond this into predictive analytics, so in the case of our diabetes patient, by gathering a lot of the data, like let's say the healthcare provider might know that a patient has been out for a few drinks the night before, that they're sitting on the couch watching their 6th episode of their favourite box set on Netflix, and be able to maybe predict that there's a hypoglycemic event about to occur and prompt them to take action, either go out for a walk or take a piece of fruit or something like that. But I suppose from a risk perspective, it's entirely different, kind of predicting some of these events happening and then treating some of these events, let's say with prescriptive analytics. So if you're on the couch watching your box sets and the device actually adjusts your insulin based on the outcomes, that's a completely different risk model for the companies. And we're quite a way off that. So there's lots of questions here that really need to be answered to get some of these devices that will be genuinely differentiated and genuinely give an impact to the patient. So some of the questions are around kind of power harvesting, how to incorporate batteries and into some of these devices, especially in the implantable devices, sensor size, cost reduction, connecting that data then into a cloud in a secure way, where it's accessible into an electronic medical record system, which is accessible across multiple healthcare providers, in a way that both the data and the device are secure, is the competencies which is completely outside the current competencies of life science companies. And then transforming that in a way which mitigates the risk in a regulatory landscape, transforming that data into predictive analytics and prescriptive analytics is something that, again, is completely outside the current capabilities of these companies. But there's a lot of collaboration in this space at the moment, and this is just in the last year in the diabetes space. You can see that the major life science companies are collaborating with the major technology companies. this is, as I say, it's in the last year. The majority of the areas that they're collaborating with are around the data analytics and the technology, specifically for kind of reducing the sensor size and incorporating power. So, I suppose in conclusion with this, there's quite a lot of business-to-business collaboration that really kind of we're trying to position Ireland as being a great location to do, to complete some of these R&D activities. And a lot of this is from across sectors, so it's not just the life science companies anymore. Google and the Facebooks of the world are going to be really active in this space. So how do we support these companies? Well, I suppose IDA is a funding agency. Our sister agencies are Science Foundation Ireland and Enterprise Ireland. We support our companies a lot with in-house R&D that they might want to do, and then we help them engage with the collaborative R&D with the research institutes, such as the Innovation Partnership model that I spoke about earlier. So with our R&D grad support, I suppose the aim of that is really to develop innovative products and to really kind of have a sticky investment in R&D in Ireland. Typically we support in the region of 10 to 15%. I suppose that's really quite competitive when it's added on to R&D tax credits, to knowledge development box, and some of the innovation partnerships or SFI supports that are available. And the qualifying expenditure for this is relatively comprehensive, and the timeline is very quick to get turned around with great technical assessors that can turn them around very quickly. So that's pretty much all I have today. If you have any questions, go ahead.